Hey, thank you again, and thanks, Rick, for your dependable one-liners. Holly and gang, who's Nelson and Warren? Are the next up. So Holly Weiss gets the job of moderating this time. Some of you may have remembered she got to be a debater once before and had a position that you couldn't possibly defend, and did a great job at it.
Hello, I'm Holly Wise, and I'm from the Medical University of South Carolina, and I represent the American Council of Academic Physical Therapy. It's my pleasure to introduce our speakers and our proposition for the next debate and continue our discussion on the drivers and trade-offs of accreditation. The next proposition will examine the benefits and risks associated with accreditation for health professional education in low-resource countries. Currently, there is significant variation around the world in the structure and quality of health professional education, and questions continue to arise regarding the process of quality assessment and assurance provided by an institution in relation to standards that are appropriate for countries with low resources. Our two debaters are well versed on this topic, and it's with great pleasure that I introduce them. So first, I'd like to introduce Nelson Siwankambo, who is from Makerere University in Uganda. He has devoted the last 15 years of his career to the advancement of medical education and research capacity, and has initiated a consortium that involves 7 universities in Africa and 2 universities in the UK. He's also helped start a consortium of Uganda universities to jointly address health professional education needs. So as you can tell, he's well qualified to speak on the topic. I'm not going to tell you what side, though, until after our vote. Warren Newton is the Vice Dean of Education at the University of North Carolina School of Medicine in Chapel Hill. His major scholarship focus is the organization and effectiveness of healthcare. He currently chairs the board of North Carolina Health Quality Alliance, as well as he chairs the steering committee for the North Carolina Improving Performance in Practice. So let me just give you the overall of what we're going to do now that you know our speakers and you know the topic. We're now going to do a pre-debate vote. And we have somebody at each table already identified, and I'm going to try Rick's technique of saying, all right, first in the affirmative, raise your hand if you support the debate proposition that accreditation stimulates progress in low-resource countries. So let your person at your table know your vote. Raise your hand. You're in support of that proposition statement. Okay, all in opposition? And just for grins, all undecided, let your person know at your table. So it's important because we do share the vote at the end to see if there's a change, to see if we can change those undecided votes. So take a stand. So each speaker is going to have 4 minutes to debate. We increase the time for the group discussion, and then we'll re-vote again. So with this team, despite the previous proposition team's efforts, we received accreditation. These are well-established positions that they are taking. So as we say in the U.S., buckle up for an exciting debate, and Nelson will speak in favor of the proposition statement.